Welcome back to our program, Screening, Brief Intervention, and Referral to Treatment for the Special Needs of Older Adults, or SBIRT Plus. The main goals for the program today are listed on the slide. Our main focus is to introduce the brief intervention and discuss how it works. The brief intervention is a short, semi-structured discussion that uses the principles of motivational interviewing. The goal of following the same basic steps is to help stay focused and keep the discussion short. Most busy professionals don't have time for lengthy interactions, so the goal is to stay under 15 minutes. Motivational interviewing, or MI, is an increasingly popular approach for discussing health-related behaviors with patients. It places the responsibility for change directly on the patient. The provider's job is to support the person in reaching their own conclusions about change. This is a big shift from telling people what to do based on the expert knowledge of the provider. MI is a strength-based approach as opposed to a weakness-based approach. The aim is to build on the person's skills and abilities. The approach is person-centered, meaning we stay close to the values, beliefs, and experiences of this individual. We also stay clear of labeling, which mostly leads to distrust and feeling stigmatized. MI seeks to create a partnership with the person and empathize with their situation. The provider and person are on the same side in an effort to help the individual identify and achieve goals related to improved health and social well-being. 4 basic approaches, which are abbreviated as ORS, are key to the brief intervention. Using open-ended questions is important to gathering information about the person and how he or she sees the situation. Work to ask questions that require description instead of yes or no answers, which lead to the question-answer trap and no new information to guide the discussion. Remember, the goal is to find ways to support the person's uncertainty, their ambivalence, about their current choices. Affirmations are another important way we can help the person find stronger solutions to issues. Think about how you can praise, reinforce, or thank the person for talking about difficult issues. Reflective listening is the key. That means listening with the intention of understanding the person's viewpoint and then reflecting ideas or issues back to the person in a non-judgmental way. Reflecting what the person said can be just a simple restatement, but in slightly different words. The goal is to stay close to the message and not go further. Another way of reflecting is to make a guess about what the person has said. More complex reflections can also guess about the underlying feelings the person has. In the example on the slide, the person didn't say he was disappointed, but that might be an important part of their discussion, how disappointed he is with not having support and help to make changes. Finally, the double-sided approach reflects back on both sides of the issue. This gets at the ambivalence the person has, which is important in helping them tip the balance to try something different. Summaries are also important. They don't have to be long and should be introduced in a way that says you are checking for understanding. You want to really understand the problems and issues from the person's viewpoint. So ORS is the foundation for using the brief intervention. Let's talk about that now. The brief intervention is designed to help the client think about the issues. Many people may not know the low-risk limits for substance use, link their substance use to consequences, be motivated to change their substance use behavior, or know what choices to make. We can assist the patient in all of these areas using the brief intervention, which some call the brief negotiated interview, to emphasize the give and take in the conversation. It is important to remember that these goals are fluid and depend on a variety of factors. The brief intervention is an algorithm which helps healthcare providers explore health behavior change with patients in a respectful, non-judgmental way. Instead of telling the patient what changes he or she should make, the intervention is intentionally designed to elicit reasons for change and action steps from the patient. It gives the patient voice and choice, making any potential behavior changes all the more empowering to the patient. Since no two patients are the same, the practitioner must remain open-minded and fluid in what they attempt to accomplish. In summary, the stepwise process doesn't add a lot of time to interactions with older adults and has a lot of value when we think about the health consequences. As we just reviewed, lots of people don't know what safe limits are and don't understand the health-related implications of alcohol and drug use. Screening is easy to do and can be done by just about anyone. Given that the rates of risky drinking in later life are fairly low, practitioners won't use the brief intervention very often. In turn, it might be best to have only a few people trained to do that part so it is done well. Again, the stepwise process for older adults is more concentrated in the screening area and low-risk drinking. This is also a great time to talk about safe limits and use the educational handout. The brief intervention is a skill that is based on motivational interviewing principles. OARS is a good starting point, but more training will help providers gain needed skills. In the next part of the program, we'll take an in-depth look at the brief intervention, offer some practice ideas, and also talk about referral to treatment. Thanks to our funding agency for supporting this program.